Hello, everyone, and Happy New Year. It's Kathy Widener, Kathy Mills Chang here. You know, I noticed because I'm part of who gets the emails for our help desk for our members of KMC University, the exponential number of questions that are coming in about how to find your Medicare fee schedule for 2024 for Part B. And I thought, why don't we just take a moment and put some information together for you? Because surely if our members are having that many questions, even those that are not our members are struggling with the same thing. So I thought I would walk you through exactly how this is supposed to work. So let me get out of your way here, and we're going to start with just a simple Google search. And you know what I'm going to do is I'm going to say Novitas, Medicare Part B. You would simply put the name of your Medicare Part B administrative contractor. Hopefully you already know who that is. You may already have a login to that portal, which I hope you do. Everyone should have a login to the portal of their Part B. I live in Colorado. I'm just going to go here. So Novitas is my payer. And if you don't know who that is, let us help you find that. We would certainly be delighted to do that. All right, I'm going to go over here on the side. Actually, I'm going to make it a little bit smaller. So you notice there's a big list of things. In almost every site, you're going to find such a thing. Now, I am in jurisdiction H, and it's for these states. Maybe Novitas handles a different jurisdiction. You always want to be sure that you see your state, and of course I see Colorado. I'm going to go down until I see fee schedules. They make it very simple for us to do this. And I want to search and download fee schedules. Now they have a very nice portal here. I'm going to tell you that almost every payer does it a little bit differently, but we're simply going to check our 3 CMT codes because those are the only codes that you need to really worry about. So let's start with 98940. And we're going to use a 2024 date of service. It doesn't matter what date you use because it just matters that you're in 2024, and then select the state that you're in. Now sometimes within a state, the state is actually divided up. Like New York, for example, might have different localities, so you'll have to know which locality you're in. Colorado is the entire state. So we're going to search, and this is what we'll find. When you scroll down, we can see here that the information we have, I'm going to just use a little marker so that you can see where my information is. So you can see right here, we are under the fee schedule. You notice over here that there is when performed in a facility setting. So most of the time you are not performing in a facility unless you are a part of a hospital or something like that. If you're a participating provider, this is your number. If you are a non-participating provider, the maximum you can charge is the limiting charge amount. The non-participating provider may choose to accept assignment on a case-by-case basis. And when they do, this is the most that they can charge, is the $26.14. Now you notice that indeed it is less than the par provider. So whatever you do, don't be a non-par provider and then accept assignment all the time. You're costing yourself about $1.50 every single visit. So once you collect this information, the great news is that we can now go back and we can do 98941 and find the same information. And search again, and here is our information for that. Now, I will tell you that some payers have been changing their fees here right at the beginning of the year. So some doctors choose to hold some of their billing until closer to the end of January, although some of your patients may be, in fact, meeting their deductible, so that makes it a little more difficult. The other thing that's great about knowing what this number is that if you assume and you've gone into, in this case, the Novitas sphere, you can tell whether the patient's deductible's been met or not. If you assume it hasn't, now you know what to collect from them at the time of service when you expect your visit to be applied toward their deductible. In these cases, of course, if you're non-par, you're collecting this either way, and then they will be reimbursed or not. So different payers kind of have different rules. So I thought I would just take one more moment to show you how we might find something, let's say National Government Services Medicare. So if we go to their homepage, just for illustration's sake more than anything else at all, we're going to accept all of their business here. I don't want to log in. I'm not a member. I'm going to say I am a Part B in, let's just call it Massachusetts, and enter. You will find this information on almost every site. So now I want to go and find fee schedules. There it is. Now you'll notice that theirs might look just a teeny bit different. When they ask you what type of a fee schedule you want, it is the Medicare physician fee schedule pricing that you want to find. I don't want the whole thing. I just want to look at one code. Again, I'm going to say 01 04 24. And then I will list my codes the same way that I did before. Now in this case, I'm in Massachusetts, and you notice this is one of those examples where there are two things. So you can find by doing a search, if you don't know for sure, which area you are in for your jurisdiction. Let's assume that I'm in the greater Massachusetts area. And once again, we find the same information, laid out just a teeny bit differently, right? So 98940. For this locality, it's the adjustment of one or two regions. I do not want facility. So see how this is non-facility? That's what I want there, is non-facility. And you notice that under the OPPS, they're all zeros. So we know we don't belong there. We belong up here. So we have a non-facility participating. We have a non-facility limiting charge, and we have a non-facility non-par allowed, just in case we wish to accept assignment on a case-by-case basis. It's always a pleasure to work with you one-on-one on these things. We're delighted at KMC University to serve you. I hope that you will follow us on Facebook, or even more so, join our chiropractic reimbursement and compliance experts community that we have there, where we answer questions, and we would be delighted to serve you. I hope 2024 is the most amazing yet.